Bismillahirrahmanirrahim. Assalamu alaikum. Previously, we covered the first and second layer of the muscles of sole of foot. Today, we'll be continuing on with the third layer of the muscles of sole of foot. So, in the third layer, we have three muscles, two of them being flexors and one adductor. So let's start with the flexor hallucis brevis, right? So the flexor hallucis brevis is this muscle here, right? It originates from the plantar surfaces of the cuboid and the lateral cuneiforms. So this diagram here shows you a good origin and insertion of the flexor hallucis brevis. So this muscle here is the flexor hallucis brevis. It originates from the plantar surfaces of the cuboid bone and the lateral cuneiforms, right? So you can see the origin of the flexor hallucis brevis, and then it has two heads. It splits into two heads, and both of these then insert into both the sides of the base of the proximal phalanx of the big toe, right? So this is the proximal phalanx of the big toe, and the flexor hallucis brevis gets inserted into the base and then both the sides of the base of the proximal phalanx of the big toe, or the first digit, right? And within its tendons, these two heads contain the sesamoid bones, which we talked about before as well. So this is the flexor hallucis brevis muscle. It is supplied by the medial plantar nerve. Now, since it is attached to both the aspects of the base of the proximal phalanx, it does not bring about any abduction or adduction. It is in fact responsible for bringing about flexion of the proximal phalanx of the big toe. So here you can see the flexor hallucis brevis, right? Hallucis, of course, means that it is related to bringing about movements at the big toe, and you can see the two heads of the flexor hallucis brevis, this one being the medial head and this one being the lateral head. And here you can see the two sesamoid bones, and then it's going to get inserted into the base of the proximal phalanx of the big toe. And within these two heads you can see the tendon here. Remember, we talked about this before, the flexor hallucis longus tendon, and these are the two heads of the flexor hallucis brevis muscle. Okay, so the next muscle in the third layer is the adductor hallucis muscle. Again, this muscle is responsible for bringing about the adduction of the big toe, and adduction being the movement of the big toe towards the second toe, right? So adductor hallucis is comprises of two heads. It has an oblique head and it has a transverse head. So the oblique head originates from the bases of the second, third and fourth metatarsals, right? So you have the second metatarsal would be about here, the third and the fourth, and then this oblique head originates from the bases of the second, third and fourth metatarsals, and this one is the transverse head. The transverse head originates from the plantar ligaments of the metatarsophalangeal joints. So here you can see the deep transverse metatarsal ligaments as well as the plantar ligaments, right? So you can see the plantar ligaments here, and it is these plantar ligaments here which give rise to the transverse head of the adductor hallucis muscle. So this here is the oblique head and this here is the transverse head of the adductor hallucis muscle. Now both of these heads are then inserted into the base of the lateral side, or rather the lateral side of the base of the proximal phalanx of the first digit or the big toe, right? So on the lateral side, this is the proximal phalanx of the big toe, and on the lateral side of that you have the insertion of the adductor hallucis muscle. So what it would do is that once this muscle contracts, it is going to move the big toe to this side. So that would lead to adduction of the big toe. Now the adductor hallucis is supplied by the deep branch of the lateral plantar nerve, right? In addition to bringing about adduction of the big toe, it is also responsible for assisting in the transverse arch of the foot by the metatarsals. Now the third muscle in this third layer of the muscles of sole of foot is the flexor digiti minimi, this one here. Now the flexor digiti minimi brevis muscle, it originates from the base of the fifth metatarsal, right? So here you have the fifth metatarsal, and this flexor digiti minimi brevis originates from the base of the fifth metatarsal bone, and it gets inserted into the base of the proximal phalanx of the fifth digit. So this is the fifth digit, and the flexor digiti minimi brevis gets inserted into the base of the proximal phalanx, which would be about here, right? So this is the proximal phalanx here, and this is the base of the proximal phalanx, and here you can see the flexor digiti minimi brevis being inserted into the base of the proximal phalanx of the fifth digit. Now it is supplied by the superficial branch of the lateral plantar nerve, and its action is that it brings about flexion of the proximal phalanx of the fifth digit, and it causes flexion of the little toe at this metatarsophalangeal joint here. Now we move on to the fourth layer of muscles of sole of the foot, and this fourth layer comprises of the interossi. Just like in the hand, we have two sets of interosseous muscles. In the hand we have the palmar and the dorsal interossi, and in the foot we have the plantar and the dorsal interossi. So let's talk about the plantar interossi first. We have the three plantar interossi. These three, as you can see here, these are unipinnate, and they originate from the medial sides of the plantar aspects of the third, fourth, and fifth metatarsal bones, right? So the third, the fourth, and the fifth metatarsal bone give rise to these plantar interossi, and they get inserted into the proximal phalanx of the third, fourth, and fifth digits, the proximal phalanges of the third, fourth, and fifth toes of the foot. So these plantar interossi emerge from or originate from the medial side of the shaft of these metatarsals, and they get inserted into the medial side of the base of the third, fourth, and fifth phalanges. Now when these plantar interossi contract, what they're going to do is they're going to pull these toes towards the second digit. Now this is the reference point here, because no plantar interosseous muscle is acting on this digit, so we'll take that as the reference point, and all of these the third, fourth, and fifth toes or the fifth digits of the foot would move towards the second digit. As a result of this, adduction of these toes would take place. So just like in the hand, in the foot as well, the plantar interosseous bring about adduction of the toes, just like the palmar interosseous bring about the adduction. So we had that code to remember things of the PAD and DAB. So again here we can use the same formula here. So PAD, which means the plantar interosseous muscles would bring about adduction of the third, fourth and fifth toe. Now the plantar interosseous as well as the dorsal interosseous are supplied by the lateral plantar nerve. In addition to bringing about adduction of the third, fourth and fifth digits, these plantar interosseous also flex the metatarsophalangeal joints of these three digits. Okay, now let's talk about the dorsal interosseous muscles. Now these are 4 in number, and as you can see here, they are bipinnate. These originate from the adjacent sides of the shafts of the first, second, third, fourth and fifth metatarsal bone. So all of the metatarsals, from the adjacent sides of all the metatarsals, these dorsal interosseous muscles take their origin. Now when it comes to the insertion, the first dorsal interosseous muscle gets inserted into the base of the fifth, on the lateral side of the second phalanx, the proximal phalanx of the second digit, right? And when it comes to the second dorsal interosseous muscle, this then gets inserted into this the lateral side of the base of the second digit, the proximal phalanx of the second digit. So the first one and the second one together, when they contract on the two sides, the first dorsal interosseous muscle is attached to the medial side of this digit, and the second dorsal interosseous muscle is attached to the lateral side of the proximal phalanx of the second digit. So the action of these two cancel each other, and again the second digit remains neutral during abduction here. So this would stay in place, and therefore we can take it as a reference point. The rest of them would move away from the second digit, right? Because the third dorsal interosseous muscle, it is taking its origin from the adjacent sides of the third and fourth metatarsals here, and it gets inserted onto the lateral side of the proximal phalanx of the third digit. And similarly, from the fourth and fifth metatarsals originates the fourth dorsal interosseous muscle, and this gets inserted into the lateral side of the base of the fourth digit, proximal phalanx of the fourth digit. So as a result, contraction of these muscles would lead to this one would stay in place, and these, which means the third and the fourth digits, the third and the fourth toe, would move away from the second toe. So the dorsal interosseous muscles bring about abduction of the toes. So that's about it, about the 4 layers of the muscles of the foot. Thank you very much.